Good afternoon. Welcome to the Assembly Committee on Health and Human Services. Would the Secretary please call the roll?
Assemblywoman Gonzalez. Here. Assemblywoman Gorlow. Here. Assemblyman Gray. Here. Assemblyman Hafen. Here. Assemblyman Hibbets. Here. Assemblyman Koenig. Here. Assemblywoman Newby. Assemblyman Wynn. Here. Assemblyman Ornlicker. Here. Assemblywoman Taylor. Assemblywoman Thomas. Chair Peters.
And I am here. Please mark Assemblywoman Newby and Assemblywoman Taylor as present when they arrive. We have a couple of items on the agenda today, a hearing and work session. We're going to start today with the hearing. A couple of housekeeping items, though, before we open those agenda items. We ask that all folks in the room please check and make sure that your electronic devices are muted so we're not interrupting folks as they're presenting and speaking. Members of the public may provide testimony in a variety of ways, all of which are listed on the agenda. You may also submit public comment in writing either before, during, or up to 24 hours after meeting's adjournment. If you wish to testify in person, please sign in by the door and leave a card. If you do not wish to testify, you may also wish to sign in so that we have a record of those who are interested in bills in the event we'd like to contact you. To ensure an orderly flow of discussion, comments, questions, and responses must go through me, and committee members must be recognized by me before you can speak. Additionally, I ask our presenters on Zoom to leave your cameras off and microphones muted until it is your turn to present or I direct any questions to you. When testifying in person, please turn the microphone on to speak and off to listen because we want to keep our record clean for transcription. And with that, we will move on to our agenda. We're going to start, as I said, with our bill hearing today. We are hearing Assembly Bill 466, which revises provisions relating to crisis intervention. Sorry, go ahead.
Madam Chair, I'm sorry, I just wanted to let you know before the meeting, but I'm at the call of the chair over in the Senate to present a bill, so I may have to step out.
I'm waiting for one more member before we can start the work session. So hopefully we catch everyone when they're in the room. Oh, here we are. All right. Maybe we do a brief pause real quick and we'll do the work session when we have everybody because I think we'll lose a couple of folks to other committees. Sorry about that. So okay, we're going to go into work session. Sorry about that, everyone. Everyone has the work session documents in front of you or emailed to you, and you had an opportunity to review these bills and listen to the hearings. I would ask staff to go over these bills, and we will vote on them individually as we go. Please, Mr. Ashton, go ahead.
Thank you, Chair Peters. For the record, Patrick Ashton, Research Division, Legislative Council Bureau. The first bill in the work session document is Senate Bill 4, which was heard on May 12th. It authorizes DHHS to provide grants or enter into contracts or intergovernmental agreements financed by the Fund for a Healthy Nevada to pay for or subsidize the costs of prescription drugs, pharmaceutical services, and certain other benefits for Nevada residents. There were no amendments. Thank you, Chair.
Thank you. Assembly members, are there any questions? Committee members? Seeing none, we have a motion from Assemblyman Wynn. A second? Second from Assemblywoman Newby. Any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay? That motion passes unanimously. We'll move on to SB 117. I'm going to do floor statements after we do everything.
Thank you, Chair Peters. For the record, Patrick Ashton, Research Division, LCB. Senate Bill 117 was heard on April 28th. It authorizes the Director of DHHS to include in the state plan for Medicaid coverage for the services of community health workers who are supervised by specified types of healthcare providers other than physicians, physician assistants, or advanced practice registered nurses. There were no amendments. Thank you, Chair.
Any questions, committee members? Seeing none, I would entertain a motion to do pass. I have a motion from Assemblyman Wynn, a second from? Assemblywoman Gorlow. Any discussion on the motion? All those in favor, please signify by saying aye. Aye. Any opposed, nay. And that motion passes with those present. And for that one, I'm going to give that one to Assemblyman Gray, and SB4 I will give to Assemblyman Hibbets, please. We'll move on to SB 119.
For the record, Patrick Ashton, Research Division LCB. SB 119 was heard on May 15th. It requires a third-party payer other than an industrial insurer to cover telehealth services in the same amount as services provided in person or by other means if the services are delivered to patients at eligible originating sites in rural areas or by certain healthcare facilities, excluding services provided through an audio-only telehealth interaction, or for counseling or treatment related to a mental health condition or substance use disorder, including services delivered through an audio-only telehealth interaction, and are provided to patients on or after July 1st, 2023. Further, the bill retains the requirement that a third-party payer who is not an industrial insurer covers certain services provided through telehealth, except for services provided through audio-only interaction, in the same amount as services provided in person or by other means between May 20th and June 30th, 2023, which otherwise would have expired. There were no amendments. Thank you, Chair.
Thank you. Are there any questions? Seeing none, I would, oh, yep. Oh, thank you. I would entertain a motion to do pass from Assemblyman Gray and a second from Assemblyman Hafen. Beat everyone to it. Thank you so much. Is there any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay. That motion passes, and I will give that floor statement to Hafen? Okay. You're welcome. All right, we'll move on. So folks, SB 146, I was notified of an amendment, so I am having staff send that around to everybody. We're going to move that to the next meeting. So we will skip SB 146 and move on to SB 172. Mr. Ashton.
Thank you, Chair Peters. For the record, Patrick Ashton, Research Division LCB. SB 172 was heard on May 5th. It authorizes a minor to give express consent to services related to contraception and the examination, treatment, or prevention of sexually transmitted diseases. There's an amendment by Senator Harris, who proposes to amend subsection 2 of section 1 to clarify a minor may give express consent to certain entities to A, provide services related to the prevention of sexually transmitted diseases, or B, issue a prescription for the dispensing or administration of a contraceptive drug or device. Thank you, Chair.
Thank you. Is there any discussion on this item? Or questions on this item? Sorry, discussion comes next. Seeing none, I would entertain a motion to amend and do pass. From Assemblywoman Thomas and a second from Assemblywoman Newby. Is there any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed? Please raise your hands. We have nays from Assemblyman Hafen, Assemblyman Koenig, Assemblyman Hibbets, and Assemblyman Gray. The motion passes with those present. And I would assign that to Assemblywoman Thomas.
Thank you, Chair.
Thank you. All right, SB 117, Mr. Ashton. 177.
Thank you, Chair Peters. For the record, Patrick Ashton, Research Division LCB. SB 177 was heard on May 3rd. It codifies an existing requirement that Nevada Medicaid must automatically cover antipsychotic and anticonvulsant drugs under certain circumstances, and it extends this requirement to health maintenance organizations and managed care organizations that provide coverage to Medicaid recipients. There were no amendments. Thank you, Chair.
Thank you. Are there any questions? Seeing none, I would entertain a motion to do pass from Assemblywoman Gonzalez and a second from Assemblywoman Newby. Any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay. That motion passes, and I would assign that to Assemblywoman Newby. Thank you. We'll move on to SB 260.
Thank you, Chair Peters. For the record, Patrick Ashton, Research Division, LCB. SB 260 was heard on May 8th. It requires a senior living community referral agency to disclose certain information to an aged person or the person's representative and to obtain the consent of the person or representative before making a referral. Additionally, the bill prescribes the authorized methods for determining the amount of compensation that such a referral agency receives from a senior living community. There were no amendments. Thank you, Chair.
Thank you. Are there any questions from the committee? Seeing none, I would entertain a motion to do pass. From Assemblywoman Gorlow, a second from Assemblyman Nguyen. Any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay. The motion passes with those present, and we will sign that to Assemblywoman Gonzalez, please. And SB 286.
Thank you, Chair Peters. For the record, Patrick Ashton, Research Division, LCB. SB 286 was heard on May 3rd and requires DPPH, DHHS, to incorporate certain information relating to multiple sclerosis and the resources available to residents who have MS on the division's website. Additionally, the bill requires the governor to proclaim the third week of March as Multiple Sclerosis Awareness Week. There were no amendments. Thank you, Chair Peters.
Thank you. Are there any questions? Seeing none, I would entertain a motion to do pass. From Assemblyman Nguyen and a second from Assemblywoman Gorlow. Any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay. And that motion passes. All right, our last one, guys, SB 441. Oh, I'm sorry. I would assign that one to Assemblyman Nguyen, please. And Mr. Ashton, SB 441. We have a typo. And I was reading directly from the document. On our work session document in the very front, mine still says SB 441. That may have been fixed. I think mine was printed yesterday. But just for everyone's clarification, we are work sessioning SB 411, which is correct on the work session document page that I have. Mr. Ashton, 411.
Thank you, Chair Peters. For the record, Patrick Ashton, Research Division, LCB. And I apologize for the typo. It was on the front page of the work session document, but in the actual work session document, it says Senate Bill 411. So SB 411 was heard on May 15th. It authorizes the juvenile court to establish a treatment program for children diagnosed with or suspected to have autism spectrum disorders who are alleged or adjudicated to have committed a delinquent act. The court may assign such a child to the program based on certain eligibility criteria and must set terms and conditions concerning the successful program completion, informal supervision, or probation for the child as appropriate. Finally, the bill provides that the two members representing school districts on the Nevada Commission on Autism Spectrum Disorders are non-voting members. There were no amendments. Thank you, Chair.
Thank you. Are there any questions from the committee? Seeing none, I would entertain a motion. Assemblywoman Thomas, a second from Assemblywoman Gorlow. Any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay? A nay? Okay, and Assemblyman Gray as a nay, and I would assign that to Assemblywoman Gorlow. Thank you very much. Thank you. Okay, thanks so much for hanging in there with us while we get through that. That will get us moving some stuff down to the floor, and we'll close out work session and move on to bill hearing. Thank you for being patient with us. We will open the bill hearing on, or reopen the bill hearing on Assembly Bill 466, which revises provisions relating to crisis intervention. Please remember to state your name for the record before you speak so that we are able to transcribe it accurately. You may begin when you're ready.
Thank you, Chair Peters and members of the committee. It's a pleasure to be here with you this afternoon. My name is Shannon Bennett. I'm the Health Bureau Chief for the Bureau of Behavioral Health, Wellness, and Prevention with the Nevada Division of Public and Behavioral Health. I am pleased to be joined today by Allison Genko, the Public Health Resource Officer with Governor Joe Lombardo's office. Today we are presenting you Assembly Bill 466, which addresses concerns related to definitions of various telecommunication lines for collection of fees, to support the crisis response system and the 988 Suicide and Crisis Lifeline. The National Suicide Hotline Designation Act of 2020 was signed into law on October 17, 2020. This gave permission to states to collect a fee on telecommunications services to support the crisis response system and the 988 Suicide and Crisis Lifeline. During the 2021 legislative session, Senate Bill 390 established the authority for the Board of Health to adopt regulations establishing a fee on certain telecommunications service lines. However, during the regulatory process to establish the fee, telecommunication providers began to express concerns about the way certain lines were defined. Telecommunication providers did not feel the existing language gave them the appropriate authority to collect fees on all the various lines as originally intended. This decreased the projected revenue from approximately $15 million to $1.5 million annually. We have worked extensively with telecommunication providers to bring you AB 466 that we believe captures all telecommunication service lines as originally intended. I will now pass it to Allison Genko to present the amendment.
Thank you, Chair Peters and members of the Assembly Health and Human Services Committee. My name is Allison Genko, and I serve as the Public Health Resource Officer to Governor Joe Lombardo. I'm here today to present on the conceptual amendment to Assembly Bill 466, which a copy is posted on Nellis. The following are the changes that we're proposing. Under Section 1, we want to ensure all lines are captured under 988 as was intended through Senate Bill 390 from the 2021 legislative session. The second thing under Section 1 is to amend the definitions of access line, commercial mobile service, IP-enabled voice service, and trunk line to match Federal Communications Commission definitions. The third thing under Section 1 is to remove the requirement for the division and the State Board of Health to promulgate regulations and give the administrator the authority to reduce the surcharge below 35 cents if necessary. Under Section 2, we are requiring the telecommunications companies to report certain information to the division and amending the effective date to September 1 of 2023. I would be remiss if I did not thank the telecommunication companies for working with myself and Ms. Bennett on this language, and we thank you for hearing this bill, and we're here to answer any questions you may have.
Thank you for the presentation. Everyone has access to the amendment. I was just looking at it myself. I have a couple questions on my list. We'll start with Assemblyman Hafen.
Thank you, Madam Chair. And first of all, I want to say thank you for bringing this. I remember having the hearing. I believe it was Senator Ratty that brought the original 988 language. And it's something that I think is going to be a huge success for the state. As sad as it is that we need this, it is much needed. And so to me, this is a simple cleanup bill. From my recollection, it was always the intent to include all lines. And so I do appreciate the fact that you guys are here today. And so I did want to kind of touch on, again, I believe this is just cleanup bill, but I want to touch on what happens if this bill were not to move forward.
Through you, Chair, to the Assemblyman, thank you for the question. This is Shannon Bennett for the record. There are some funds that are available through our national partners, through the federal government, that will allow us to fund the suicide lifeline to some extent. The additional revenue, this $1.5 million, if the definitions wouldn't get fixed, that could also go towards that, but it wouldn't be to the extent that we would need it to be. Our federal partners have been very clear that the success of 988 at the state level is really dependent upon the state investing in the resources it has available to stand up the crisis response system.
Thank you. Assemblyman Koenig.
Thank you, Chair. So how does this impact an already overburdened and underfunded mental health system in the state?
Through you, Chair, to the Assemblyman, thank you for the question. Shannon Bennett for the record. The crisis response system is part of the larger behavioral health system. So the intention is to provide a place for people in crisis to go, to be able to capture them before and treat them, serve them before they get into the emergency department, ultimately lowering the burden on the emergency department and getting the people to the care that they need. So this, the crisis response system is meant to enhance what we already currently have, get people into the correct treatment, and the resources that they need to get better.
Thank you for the questions. I had a question related to how far these dollars go, right? So what is the touch when these dollars come in? We start with the 988 phone line and the call center, because we have a call center in Nevada that is tied into the national network, and that's been in place for a very long time. But outside of that, what else is affected by these dollars?
Thank you, Chair, for the question. Shannon Bennett for the record. The intention of the crisis response system is to have someone to call, which is everything that you just spoke about, have someone to respond if the situation requires more than just a phone call. So a mobile crisis team, designated mobile crisis team. These funds could be utilized to provide technical assistance to quality mobile crisis teams to help stand them up and to work with Medicaid to be able to fund them appropriately for any of the uninsured. These funds also could be used to do the same for crisis stabilization centers, so individuals have somewhere to go. So that's the entire piece. When you look at the crisis response system, it's more than just the phone line.
Yeah, my memory of these, we have quite a few new people on the committee, but we've been talking about the crisis care model for a long time, at least as long as I've been in this building, and I think it was even beyond that the initial discussions were really had, led by Senator Julia Ratty at the time, and it is quite layered of who all participates in that process, and in the different regions, and the more we are able to stand up each of those layers, the better off our community is, and the more folks we can capture before they go go further into crisis. So it's really a great program and scalable to the needs of our communities as long as we can find ways to fund it. Are there any other questions from the committee? Oh, sorry, Assemblyman Nguyen.
Thank you, Madam Chair. This might be a little bit too technical question, so if you have to phone a friend, I'm totally on board with that. I was just looking at, as a user of wireless, prepaid wireless service, because usually they are sold in a preset amount, like $40, $50 is like an even amount. There's no cent. That's different from postpaid, because postpaid is always, the taxes change every month and things can be. Prepay, it's a set number of amount. Is that going to be known to the consumer that they are getting something added on, or this is part of that, wholesome price that, or wholesale price that they have, and then the consumer would not know any different, and that is the responsibility of the provider to send that to the state?
Madam Chair, through you to Assemblyman Nguyen, Allison Jenko for the record. I think I'd like to have one of our folks from the telecommunications come up and answer that question.
I think if anyone's willing to come up at this point, or we can hold it and ask in testimony if they choose to come up.
Quick follow-up, Chair. Thank you. So I think the reason I asked that question is that because a lot of the prepay user may or may not be aware of the capabilities, because a lot of times I think from our and I used to be in the wireless industry, so that's why I'm a little bit more knowledgeable about this. And the beginning of the cell service, and I wasn't around that time, but during the earlier days before all this great stuff coming along, there's a lot of things that prepay wireless cannot do versus postpaid wireless. So the capability of 988 being available is awesome, and it should be, used whether or not they're prepay or postpay. So I'm just wanting, number one, I asked that question, and number two is just wanted to also raise the awareness of the capabilities that 988 can be accessed through these services as well, because, there are still a myth out there that prepay and postpay have different benefits. So I just want to make sure that we have that on public record.
Madam Chair, through you to Assemblyman Allison Jenko for the record. Thank you for addressing that, Assemblyman, and if it doesn't come up in testimony, we'll certainly work on getting an answer for you.
Thank you for the questions. Any other questions from the committee? I have one more. Okay, so we have primary primary use in Nevada. How do you determine that a person's mobile device is primarily used in Nevada? I'm not sophisticated enough to know how to do this. To me, it starts with the area code, but several folks, including like my husband, has an area code that's not from here because he got his cell phone when he was in service, and so how do you decide or determine that metric?
Thank you, Chair, for the question. Shannon Bennett for the record. As far as 988 goes, it's all about your area code. So you get routed to the call center with the area code. So 702-775 comes to Nevada. And I believe that's what is being defined here.
Okay. Are there any other questions? Okay. We will move into testimony. Thank you. We will start in support testimony, our physical locations. I would invite those who would like to provide support testimony to the table at this time. Please remember to state your name for the record before you begin. You may begin when you're ready.
Good afternoon, Madam Chair and members of the committee. Leah Case, Leacase, here today on behalf of the Nevada Public Health Association in support of the amended version of Assembly Bill 466. We have been a part of the regulation development process on the 988 system for the past interim. It has been a long and complex process because there haven't been great definitions of these phone lines. I'm not a telecommunications expert, and just really need the clarity in law that this will provide. There is a bill in the other house that we're also monitoring that has similar definitions. We have not had time to analyze the two bills and do a comparison there, but we will be grateful for clarity that this body can provide. Thank you so much.
Thank you, Madam Chair, committee members. Misty Grimmer representing Cox Communications. We are in support of the bill. As Ms. Case said, it has been a complicated process trying to figure out the definitions and exactly how it needs to be put into place. And it is good that there's a piece of legislation to make it very clear in law, because I think we all got very confused through the reg process of where it was applicable and where it was not. We are a telco, but we are just barely started in wireless, so somebody else is going to have to answer all those questions.
Thank you. Seeing no one else coming up to the table in Carson City and no one in Las Vegas, BPS, is there anyone on the phone lines to provide support testimony on Assembly Bill 466?
Chair, there are no callers to testify in support at this time.
Thank you so much. We'll move into opposition testimony here on our physical locations. Is there anyone in Carson City or Las Vegas who'd like to come up in opposition today? Please remember to state your name for the record. You may begin when you're ready.
Good afternoon, Madam Chair. It's a pleasure again to be in front of the Assembly Committee on Health and Human Services. We have actually no official position on AB 466 as written. We did not oppose its companion bill that was run in 2021, specifically because it did not include in the amendment that you have received Section 7 sub E. I think this is a great service. I certainly think this is something and a policy that the legislature should pursue. But we have concerns that tying the rate to prepaid phone cards puts an enormous amount of pressure on folks who are utilizing those types of minutes to be able to talk to their family or to get a job or to provide any of the necessary things that they can. And so putting that kind of surcharge rate on that prepaid minutes, we feel really kind of transfers the burden of most of the program to the wrong people or to people who certainly can least afford it. And so we would look forward to removing our concerns in opposition to the bill should that section come out of the amendment, and we're happy to answer any questions.
Are there any questions, folks? Thank you, Mr. Wachter. Seeing no one else coming to the tables in our physical locations, BPS, is there anyone on the phone line to provide opposition testimony on AB 466?
Chair, there are no callers to testify in opposition at this time.
All right, we will move into neutral testimony. Is there anyone who would like to provide neutral testimony? Please come up to the tables. In Carson, Las Vegas, we'll start here in Carson City. Please remember to state your name for the record. You may begin.
Thank you, Madam Chair. Randy Brown on behalf of AT&T, and it's a pleasure to be here today. We'd first like to thank Ms. Janko and Ms. Bennett for their efforts in working with us and clarifying the definitions, because as I stated, it wasn't clear about which items were accessible and which were not. And we are neutral on this bill. I would just mention through you, Chair, to Assemblyman Nguyen, there are several ways you can handle prepaid, and different companies do it different ways, but I will tell you a couple different ways that it could happen. Some companies choose to just simply absorb those fees themselves, so the carrier would end up paying that surcharge each month. Speaking of the 911 surcharge, Nevada is one of only 4 states in the nation that doesn't assess the 911 surcharge on prepaid wireless. 46 other states do that. Nevada is one that does not. So this would be something new for Nevada to assess it on prepaid, a similar surcharge, 988. But another way to do it is to decrement minutes from a prepaid card. So if a customer purchased, $50 worth of minutes, we would decrement 35 cents per month off of their minutes that they purchase. So 2 different ways to handle it, but it is possible to do. Thank you.
Thank you. Please go ahead.
Good afternoon, Chair Peters, members of the committee. For the record, my name is Jimmy Lau with Ferrari Reader Public Affairs, representing Verizon here in the neutral position on this bill. We'd like to thank the governor's office and the division for spending so much time to work with us on clarifying the definitions and the collection process. Thank you.
Thank you. Please go ahead.
Good afternoon, Chair and Committee. Shelley Capurro, representing Charter Communications. Charter is in support of the Department of Health collecting these funds to support the 988 hotline. We also are in support of the definitions. They are needed to do that as intended in SB 390 last session. And we definitely want to thank the governor's office and Ms. Barak and Ms. Janko in helping us get to this amendment. Thank you.
Thank you. We will move to the phones. BPS, is there anyone on the public line to provide neutral testimony on AB 466 today?
Chair, there are no callers to testify in neutral at this time.
Well, thank you so much. Well, before we close out the hearing and take final remarks, Mr. Robbins has a response on the place of use.
Yes, Eric Robbins, LCB Legal, for the record. So the definition of place of primary use in the proposed amendment references 4 USC 124, and that section defines place of primary use as the street address representative of where the customer's use of the mobile telecommunications device primarily occurs, which must be the residential street address or the primary business street address of the customer and within the licensed service area of the home service provider. So the way that I read that, it would be, it wouldn't necessarily be the area code. If you were someone like me that lives in Nevada and has an out-of-state address, it would be like the home address where you're billed at. So that's how I interpret that.
Thank you for the clarification. Are there any questions regarding those two clarifying points that we received? And okay. All right. What would the sponsors like to come up for closing remarks? All right. We're waiving closing remarks and we'll go ahead and close the hearing on Assembly Bill 466. That brings us to the end of our agenda for today. Blew right through that, y'all. We will take closing public comment here for the last bit. Can I do it after public comment? All right, and then Assemblyman Gray has a comment that he'll make at the end. We're going into to public comment. Anyone in the room who would like to provide public comment is welcome to come up to the tables, both here and in Las Vegas. We do ask the public comment be limited to 2 minutes for fairness and opportunities to speak. I do not see anyone coming to the chairs in our physical location, so BPS, is there anyone on the line for public comment today?
Chair, the public line is open and working, but there are no callers at this time.
Thank you so much. We'll go ahead and close public comment, and Assemblyman Gray, please go ahead.
Thank you, Madam Chair. I'd like to correct the record, if I could, on SB 411 on the vote. I pulled a Bert Gurr. I was reading my comments under AB 411, and with everything that's gone on, I kind of messed that one up. So I want to go on record as a yes. That should have been a unanimous, and so if we could please correct that record, I'd really appreciate it.
I don't think we can correct the vote record, but we will definitely include that in the record for the meeting, and you'll have an opportunity to vote for it on the floor when it makes its way down there. But that will be included in the minutes for today. Any other closing remarks before we adjourn? Well, thank you all so much. We will have a meeting on Friday. I believe it's at 1:30, but likely a call of the chair at some point on Friday. So make sure your attaches are keeping an eye out for any emails or potential changes to those. And then the work session agenda will come out soon. All right. With that, we are adjourned.